Hi, and welcome to KCHC Pulse, your community, your health, and your community health center, brought to you by Kinston Community Health Center. My name is Anna Kinsey, and I'm your host today, and I have the pleasure of having Margaret Sharp with me. Margaret is the Community Impact Director with the American Heart Association. And Margaret, thank you so much for taking time out of your day and spending it with me this morning.
Absolutely.
So how are you?
I'm great and happy to be here. I really appreciate this opportunity, Anna.
Good, good. Margaret and I have worked with each other for a couple of months now, and it truly is a pleasure to work with Margaret. She is just has a wealth of knowledge about your cardiovascular health, and I'm excited to talk with her today. But I was thinking, I love your title. I want to hear more about what you do, not only for Eastern North Carolina, but for Kinston as well. Can you
Certainly.
share something?
Sure. I'm proud to be the Community Impact Director for Eastern North Carolina. So I cover from Wayne County, which is where I live, to the coast, up to Virginia, and then down below Wilmington. So
Wow.
I do cover over 30 counties. Kinston has a special place in my heart because we're right next door. And the partnership that American Heart Association has had with Kinston Community Health Center that was before I even joined the scene. I've only been in this position for about a year and a half, was really around clinical quality and making sure that it didn't matter where your zip code was, that you live, whether you're in an urban area or a rural area, that we all deserve the same quality of health care. And so KCHC has been committed to that for years. So it was an easy connection to start working right next door in the county over. So in my role, I really focus on four main areas: blood pressure control, CPR, and specifically hands-only CPR, nutrition security, and then also tobacco cessation. So we originally started working together around the blood pressure control with
right.
you guys for community-facing quality, but also recently we've placed a blood pressure station for the staff here at KCHC to make sure that we're taking care of the caregivers, that they have time to take good care of their own health. And we all spend more time with the folks we work with than we do the person that we're married to.
That's right.
And so making sure that we support each other in the workplace is another good opportunity for encouraging lifelong health.
And the phrase "your work family" is makes an impact in itself, because you're worth your colleagues more than you are your family sometimes. So
Exactly.
taking care of our health is important. But I want to go back to one thing. You said that when you and I met, you had only been with the American Heart Association for a year and a half?
In this role, I was previously working on a grant that was totally focused on workplace health promotion. And so I recruited companies in the Eastern North Carolina area to participate in more structured workplace wellness. Now we're calling it workforce well-being, to make sure that we're looking at all aspects of our health and well-being. And the challenge at that time was the grant came through and then COVID hit. And it was originally going to be a lot of lunch and learns and going into businesses, and we had to pivot and get creative. And we created a portal that resources were available that companies could take a walking challenge off the shelf and have a weekly message of, how important it is to get moving and the importance of drinking water, and really customize. So that gave me some connections in Eastern North Carolina, that when this opportunity came along to have our first Community Impact Director in Eastern North Carolina, I already had some great connections with folks. And so I've spent the last year and a half kind of on a listening tour. American Heart Association is really focused on meeting people where they are and finding the nonprofits and healthcare partners that are already out there doing this great work, and how can we support that? How can we bring the resources of our organization to support what you're doing and make sure that we're all at the same level, high quality of care?
I think that idea is awesome, and a lot of companies, organizations, especially healthcare entities, are following that model, because what you said was important. We have to take what we're doing out to where the people are, out to the organizations that are delivering their services to people, because if we try to do it by ourselves, we won't make an impact.
Exactly.
And so that is a good path to follow for the American Heart Association, because they have truly made an impact everywhere, in a lot of places. I think that in one of our past conversations, you also told me that you are a registered nurse.
Yes, I am.
Okay.
I am. So my career has really been about empowering people with knowledge about their own health so they can make the best choices for themselves. And so, again, I feel like this is the best job I've ever had. And as you can see from the gray, I've been working for a while because I get to bring all of me and all of the parts of my career. And I continue to learn and grow myself. That's one of the great things. Challenges sometimes with the American Heart Association is everything we do is research based. And so as an employee, I have access to all the latest research to make sure that what I'm saying really is backed up by the numbers, by people who have lived the life, who have tried the medications, who have done the lifestyle changes, and we can see that it really makes a difference. One example of that would be hands-only CPR. I've been in healthcare. I became an EMT when I was 16 back in the day in Virginia. So
That's awesome.
I was a junior rescue squad member. And, we learned about compressions and rescue breathing, and we've changed that now to be what really matters is the compressions, and that's based on science. So we want everyone to understand that it takes two things: call 911 and push hard and fast in the center of a chest to save a life.
I was really amazed when our Heart Corps members came and started teaching that hands-on CPR. And I'm glad you're talking about that, because not only the Heart Corps program does that AHA have, but I'm sure they have other programs that you take through Eastern North Carolina. So tell us some of the things about the other programs.
Sure. As I said, the four main pillars that we're working on, blood pressure is an example. And as I said, we're setting up a station here for staff to be able to check their blood pressure. I've been able to set up a Libraries with Heart program for the Noose Regional Libraries. So any patron or resident in Lenoir County, Greene County, and Jones County can go to their local library and check out a blood pressure kit. So it comes with a blood pressure monitor, educational information, and the log sheets for keeping track of their blood pressure.
That is great. That is great.
And so that's a free resource. So what we know is that the power of knowing your numbers and partnering with your healthcare team leads to better outcomes. For many folks, the worry about knowing somebody's going to check my blood pressure, white coat syndrome, is real. You can worry your blood pressure up. And so what we really want to do is teach people the proper way to check their blood pressure, which is resting your arm, making sure that you put the blood pressure cuff on and sit quietly for 5 minutes, that you haven't exercised or had caffeine or nicotine within 30 minutes, that you check your blood pressure before you take your medicine, that you have an empty bladder, that you not cross your legs like I'm doing, that you have a chair with a back that supports you. All of those things make a difference in the numbers that you get. And that's crucial for your healthcare team, because they're making decisions about whether you need medication, whether we need to adjust your medication. High blood pressure is called the silent killer, because you can have absolutely no symptoms, but the wear and tear is happening over a lifetime on the inside of your body.
That's why when patients go into the doctor's office and the CMA or the nurse says, okay, uncross your legs and sit up straight, no talking. That's why, because they want to make sure that they're getting an accurate blood pressure reading that their provider can look at, and then, look at what their medicines are and things like that, just like you said. So those are very important points.
Exactly.
I wonder, February is important to the American Heart Association.
Absolutely.
Why is that?
It is American Heart Month, and that was designated, I believe last year was our 60th anniversary of Heart Month being declared. And so it is a national observance to really bring people's attention to the importance of taking good care of your cardiovascular health. As we said, blood pressure is a part of that. We know that more women die every year from cardiovascular complications than any, or actually all forms of cancer put together. And so highlighting that, we have our Go Red for Women, which this year will be February the 7th, where we encourage people to go red, wear red, decorate with red.
I wore red today just for you,
Yes, thank you.
Margaret.
And I have my hearts on as well. To bring the awareness that women really need to pay attention to their own heart health, and that our symptoms are different from men. Originally, most of the studies in heart health and heart disease were done with men. And so you heard about, oh, it feels like an elephant crushing pain on your chest for a heart attack. Well, that's for men. Women, our symptoms are something more like, oh, I have some indigestion, I feel a little woozy, maybe I'm dizzy, and as women, we often discount our own symptoms and don't take them seriously.
Right.
And so to support each other and to get the word out that our health is just as important, and that as women, when we go through menopause and we lose that protective estrogen, our risk for heart disease comes right up to be at the same level as men. So we really need to take care of ourselves. And so...
And I think too, women may not look at their symptoms as being important because they're being caregivers.
Right.
They're working, and along with work, they're still being a caregiver, and they have to go to soccer practice in the evening, or they have to get to a parent meeting in the morning, and so they don't look at those symptoms as anything that needs to be worried about. But what I'm hearing you tell me is that women need to pay attention to these symptoms.
Absolutely, absolutely. And we're seeing, unfortunately, and as you all know, because you care for women, there is an OB clinic here at KCHC, is that we're seeing more complications and life-threatening complications for women in their maternal care in the years, either before, because women are not coming into pregnancy being in good heart health, having high blood pressure crises during pregnancy, and then also after pregnancy. So the importance of making sure that, you think about a doctor who's an OBGYN is focused more on the actual health of the baby and getting the baby here, but to make sure that they understand and have the right tools to empower women. Again, at a busy time in your life, you have a newborn baby, you're focused so much on that baby, but you need to pay attention to your own symptoms and your health.
Yeah, and I think, that brings up another good point of integrated health care. And a lot of community health centers, they're called a one-stop shop because they have the OBGYN department and they have family medicine department. And so if the provider in the OBGYN department knows that they need to see a family medicine doctor, they can go ahead and have the family medicine doctor talk to the patient while they're there. So that way they can start the conversation and bring up the awareness of cardiovascular health with that patient.
Exactly.
So you've talked about women's health and cardiovascular care. Tell me, how does heart health affect children and maybe the minority population?
Sure. Well, when we start with children, the habits that we start in childhood are what we tend to continue into our adulthood until we have that first heart attack or get diagnosed with high blood pressure. So setting the groundwork for good nutrition, for an active lifestyle, for knowing about cholesterol, and making sure that children get their measurements done, that's equally important. The American Heart Association has a simple educational program called Life Essential 8, that there are 8 components. 4 are health habits and 4 are health measures. So the health habits are good nutrition, eating enough fruits and vegetables. It's being physically active. It's getting enough rest. And of course, I'm going to blank on the 4th one now that I'm on a camera, right?
That's okay. It'll come to you. Don't worry about it. It's okay.
And the health measures are knowing your cholesterol, knowing your blood pressure, knowing your blood sugar, and then your BMI. I remember, of course. It's anti-tobacco or smoking cessation would be the 4 habits. And so even for children, having that education and that lifestyle. So, excuse me, we have Life Essential 8 for children. We have Life Essential 8 for women. Again, making sure that we're making time for that. And then we have Life Essential 8 for everybody else. At all ages and stages of life, it's really important to have the solid foundation. Those are the important factors in health habits for prevention, but they're also the same things that we focus on for treatment of cardiovascular disease. So if you started at a young age, you can prevent. There's some things I can't change the family I was born into, and that there's high blood pressure in my mother's side of the family. But knowing that and knowing my numbers, I can make choices.
Prevention is even more important.
Exactly. And I may not be able to 100% prevent it, but I can delay it. And I can make sure that I have the best quality of life, even if I eventually do wind up with high blood pressure. So far, I don't. And I attribute a lot of that to the healthy lifestyle that I have.
So what I'm hearing, parents, is that, in following these 8 measures, one of them may be that you take away that electronic device from your child and say, okay, we're going to go walk around the block for about 20 minutes because we need to follow those prevention measures. That's very important, what we need to do. I'd love to go back, and just because it was really neat to me to hear more and learn more about hands-on CPR. It didn't used to be hands-on CPR, Margaret.
No. Right.
I mean, I remember going through CPR classes and first aid classes, and it was nothing like hands-on CPR. Everything's changed. And I get it. Things evolve. I get it. But tell me why it evolved to the hands-on CPR.
Sure.
What's the importance of that?
Yeah, exactly. Again, what we do in the American Heart Association is based on science. And so people did research to study and find out. What we know is that there are 350,000 out-of-hospital sudden cardiac arrests in this country every year. Of those, 10% of people survive. So a lot of people die from sudden cardiac arrest. Now, a lot of people don't understand the difference between a heart attack and a cardiac arrest. So a heart attack is, say my hand is the heart, the blood vessels that bring the blood to my heart, one of them gets clogged up. The heart itself is still beating, it's still working, but that one part of the heart is not getting what it needs, and that part can have damage. But the overall heart, unless it's what we call the widowmaker, which is the main artery, main coronary artery, gets clogged up. So a heart attack is a blockage. The blood is not getting through, the oxygen and nutrients aren't getting to one part of the heart. A sudden cardiac arrest is, we have what is an electrical node. There's something that makes our heart continue to beat for us. And thank goodness we don't have to make our heart beat, right? If we had to do that, that's all we'd do, was tell your heart to beat. That happens automatically. It's part of our autonomic nervous system. Something interrupts that electric pulse that makes our heart beat, and the heart can just start quivering. It goes into what we call an arrhythmia, and so it's not able to beat. So if you have a sudden cardiac arrest, everything has stopped.
Does the individual feel that? You just made a hand motion like that. Do they feel that?
No. If your heart has stopped beating, nothing is getting circulated in your body. And so that person is more than, I wouldn't say 100, nothing in life is 100%, right? But more than likely they are going to collapse and they're not going to be responsive. And so in a sudden cardiac arrest, then we need to immediately take over the work of the heart. And so what they found from doing the research is that what made the biggest difference that people survive is the compressions. Now that's for someone who's gone through puberty. Our lungs are large enough that we bring in enough oxygen with the breath that as long as we keep circulating that blood around, there's enough oxygen to keep the vital organs, our brain and our organs alive until the professionals arrive. So for anyone under the age of 11, then that good old-fashioned rescue breathing is still required. And just last month, they released an update for, again, employees get included in that too, to make sure we have the latest information, that anyone who's a victim of a drowning, regardless of the age, because you've been in the water, you haven't gotten enough oxygen, they're in a state of hypoxia or lack of oxygen, they do need rescue breathing. So any drowning victim would still need the old-fashioned. So we do still need people to take the time to become certified in CPR. But for the majority of folks out in the community, when we talk about community CPR, it's hands only. So what we're doing is we're squeezing the heart between your breastbone and your backbone to take on the work that the heart is supposed to do for you. So that's why it changed, was we found that that's what made the biggest difference in outcomes, and that for every minute delayed at the start of CPR, there's a 10% less chance of survival. So having people comfortable to know exactly what to do, the first step is call 911, and you leave them on speakerphone. Don't hang up because they're going to talk you through what you need to do. If there's an AED anywhere close by, they're registered with the state. And we also ask folks that if you have an AED in your business that you register that with your local EMS so they can also let people know where the closest AED is.
That is a great point, Margaret. I had not even thought about that.
Yes.
So you register, if you have an AED, you need to register it with your local EMS.
Yes, exactly.
Okay.
And that's one of the other things that I do in my role is to help folks that if they have an AED, to make sure that their business, their place of worship has a cardiac emergency response plan. It's great to have an AED, but that's not there for EMS. They're coming with their own equipment. That's for you to immediately intervene to help save that life. So someone needs to call 911 and stay on the phone with them. Someone needs to start compressions. Someone needs to go get an AED if there is one within a few minutes access. And so having a team means everybody knows their role, right? We need one person to call 911. We don't need 12, but you do need that one person. And so someone takes charge at a cardiac emergency and directs. You call 911. You get the AED. I'm starting. You go stand and wave down
That is
EMS.
so important because I have seen situations, where 15 people come running and then nobody can move. Nobody knows what to do. Nobody can hear each other.
Exactly.
That's so important. And I'm glad that you pointed that out.
Yeah.
I will not make you dance to it, and I won't even make you sing to it. But I heard that there are some songs that you can even sing to yourself in your head when you're doing the hands-on CPR. What are those?
Exactly. Well, Staying Alive, we actually got permission from the last remaining BG to use that song. He was honored, actually, that the American Heart Association had asked permission to use Staying Alive as the theme song for CPR, but not everyone goes back to the 70s like some of us do.
Like some of us do.
That's right. Remember those disco days. So there is, on the American Heart Association website, you can go to, or if you have a Spotify account, put in AHA and our playlist will come up. And there's everything from Johnny Cash to Beyonce to, I think we've got some Bad Bunny on there, and Will Smith, Let's Get Jiggy with It. So whatever, it's to
See,
get...
Margaret, you're even better than me. I don't know who Bad Bunny is, but that's good. I'm glad that's up there because I'm sure there's somebody watching this that knows who Bad Bunny is. And that's great because it's every genre it's for every age.
And the idea is to get the song that you will remember that has the right beat for compressions, which is 100 to 120 beats a minute. And so that's what's important, is once you start hands-only CPR, you need to keep it going until help arrives. Can't stop longer than 10 seconds to be effective. And so the more people that know CPR, the more likely someone can come up and relieve you. Because again, these are out of the hospital. These are out in the community. 70% of these out-of-hospital cardiac arrests happen in your home. So this is someone that you know and love. One of our goals for the American Heart Association is that by 2030, there will be one person in every household in this country that knows hands-only CPR.
That's great. I think
and so we need everybody. We need a nation of lifesavers is what we're saying. And we're inviting people to join the nation of lifesavers.
Well, because of you and the HeartCore workers in the American Heart Association, there are staff at the Kinston Community Health Center that can deliver health education and show folks how to do hands-on CPR. And my mind is just going right now. I'm thinking, oh my gosh, I'm hearing what Margaret is saying, and she's absolutely right. We need to have more folks that know how to do this. So, we can, maybe you can help me, Margaret, but we can have classes at the Community Health Center.
Exactly.
Let's do it. I'm right on board with you. Let's do it. Let's have classes and even make a videotape of doing it. We can put it on our social media.
Yeah.
Whatever we need to do.
Absolutely. And we found through research, because again, we're all about some research, that just watching a video of hands-only CPR made people feel more comfortable. Because 70% of Americans said, if there was a cardiac emergency, I would have no idea what to do. Yeah. And I'm afraid of doing more harm than good.
And I was going to say, I hear a lot of people saying, no, I don't want to do that. I'm scared. What if I hurt the person?
Right. You can't hurt them. They're dead. If you do nothing, this person, their heart is not coming back. It's not going to immediately start on its own. It needs us to take over. Sometimes the AED shock, it can take 3 to 5 cycles before it gets the heart going again. And sometimes it won't start until EMS gets there and they're able to give medications that can help with restarting the heart along with the electrical shock that the AED provides. So we also have videos that are already out there on the website, and we can certainly do some linking so that you all can post those.
I was going to bring that up because you mentioned videos, and so which is a great idea. I think that we need to do that. But so we're going more into like your social media. So I know the American Heart Association, you have given such wonderful information today. And I'm so glad that we invited you to come and do our podcast with us. But I know that there are going to be those that when we're done, they're going to say, no, I want more. I want to learn more about this. So where can they go? What can they do to learn more?
Well, we have right here again in Kinston a HeartCore member who is stationed at the News Regional Library. And so he will be there through August, and it's going to start offering pop-ups. So there will be another opportunity for hands-only CPR, also blood pressure
pop-ups.
Screening.
I don't know what pop-ups is.
Pop-up means that when you walk in the library, there'll be a table that's information and that he will be there. So he can check blood pressures, encourage people to come to the Kinston Community Health Center and follow up if they have high blood pressure, if they don't have a medical provider. We'll be available to do some classes for hands-only CPR. So more, KCHC is a great resource, but we want to expand that and have other resources. So they have one of the big CPR kits, like you guys have here, that Cody has access to. When his time ends, it will be an ongoing resource for the library. And so that will be something that they will talk about, where they're cataloging it so that local communities can check it out. So if the Rotary Club wanted to be able to teach it, our programs are meant to be, anyone can facilitate them. You don't have to have a registered nurse. I don't have to be there because I said I cover 30 counties. I can't be in every community at every event like I would love to be. That's why I love HeartCore. It gets more boots on the ground in the community to help with these public health initiatives. But finding opportunities to get more information, there's lots that's on our website. We have a North Carolina webpage. I have a faith-based resource guide that's ready for download so that if you have a health ministry at your church, again, we're all about meeting people where they are. And we know that we gather in places that are safe, that we feel connected, and that we have time to learn and to support each other.
And I'm sure you have a Facebook page, right?
Oh, absolutely.
Okay.
Yeah.
You have a American Heart Association has a Facebook page. Now, what about Instagram? I know that
We're
a lot
everywhere.
of times Facebook goes to Instagram. You're everywhere.
Yes.
You're everywhere, guys. So you can learn more about the cardiovascular health and learn more about what Margaret and the American Heart Association and the HeartCore members do. Margaret, thank you so much for being with us today. You have just given us a lot of information that I think we're all going to leave here and think more about throughout our day, and even in conversations that we have with our friends and family members and colleagues. And you're absolutely right. And the Kinston Community Health Center is 100% behind you in that we will help teach more people how to do hands-on CPR.
Awesome. Well, thank you for this great opportunity. And remember to go red on February 7th. And we'd love to have people post how they're going red to our sites. And I'll be sure that you have our handles to add to your social media so folks can link to it. But thank
Wonderful. You. And just remember, ladies, red is a powerful color for ladies. So that's great. So make sure you wear your red February 7th. And remember that February is Heart Health Month. Take care, and we appreciate you being with us from the Kinston Community Health Center. Have a great day.